Let's assume that we all care about everybody, that we want everyone to get the best health care possible, and we just have different ways to do it, and I will argue, of course, that the facts are on my side, but I'm not a doctor. Question of the day. Listen, I know we have a lot of former Bernie supporters here on our YouTube channel. Let me ask you, what's your position on Medicare for all, or at least how would you like to see our healthcare system changed, fixed? I think we all agree that it's flawed, and I certainly don't think that they're unreasonable proposals from the left when they talk about fixing it. I just think that they're based on inaccurate data. So this is the lead in here. All of the candidates except for Joe Biden, as far as I know, on the DNC platform, are supporting a Medicare for all or equivalent plan.
I believe we do need to move in the direction of a Medicare for all system.
And we figure out how to do Medicare for all in a way that makes sure that we're going to get 100% coverage in this country at the lowest possible cost for everyone.
I believe in a healthcare system that guarantees healthcare for all people.
See, that's why I don't want the lighting too bright in this studio.
Medicare for all is.
Let me just tell you where I am. Let's tell you where I am.
All right.
I support Medicare for all.
Now, see, you see when we're in the studio and I'm like, the lights are close and they get really bright, you look like a ghost.
It turns into this like that.
A ghost. Like a ghost. All right, so before we get to Medicare for all, the left invariably, they're going to point to a few key arguments. This is what someone needs to understand there. So this is kind of rebuttal. We've talked about Canadian healthcare systems in a lot of other countries, but specifically Medicare for all. They're going to point to a couple of main ideas. That it's cheaper, first off, in the long term than our current private insurance plan. It would be sort of 30-something trillion versus 50-something trillion dollars. And then they say that it will create better outcomes. So that it's cheaper, better outcomes. They base the better outcomes generally on life expectancy, infant mortality, subjective polling data. That's why they always talk about how popular their plan is. None of those claims, are objectively accurate. So let's go to the first claim, that it would save us money while increasing quality.
This is how much of that spending in each country is private and how much is public. Here's what's amazing.
Sorry, I should have given you a heads up that it's
America's government spending on healthcare, on programs like Medicaid and Medicare and the VA, our versions of socialized medicine, it's about the same size as these other countries. These countries where the government runs the whole healthcare system. And then there's our private spending. It's the private insurance system that makes healthcare in America so expensive.
I mean, first of all, I can't speak to your experience, but overall, the healthcare systems of these countries are quite high quality. Overall, they have higher life expectancies than we do.
I just thought he got into a fight with
overall,
an angry,
these nations
tarry, moist
better results with less money. In fact, in the UK, people love their healthcare system. It's like a national religion.
This is always what they say. They go to subjective polling. They like their healthcare system. Okay, first off, they're talking primarily about costs there.
Yes.
A lot of things would save us money. Like reusing needles. Doesn't mean that it's necessarily better quality of care.
Wouldn't be great.
Bad idea.
So, and this is really important because your worldview will determine how you look at solving the problem of healthcare in the United States. It does need to be fixed. It is a problem system. But if your worldview is primarily predicated on the idea of cheap, and that's what you see them talking about, getting it as cheap as other countries, okay, fine, but that's different from quality. If you have a worldview that requires you to examine a system and say, how can we get the best quality healthcare, which benefits not only Americans, but the rest of the world. So when they say that the United States has terrible health care, people who are Medicare for all proponents, they usually point to two studies. First is a World Health Organization report that it ranked the United States 37th in health care. Okay, but here's something that people need to understand about that ranking system. They put us far behind socialized systems, not just like Canada and the UK. We're behind Saudi Arabia and Colombia. And just so you know, we're right neck and neck with Slovenia and Cuba. So you have to ask yourself, hold on a second, there's a wider gap between how good Canada's system is to the United States than the United States and the next two on the list are Slovenia and Cuba? That's because these disproportionately weigh people's subjective polling standards. Do you like your health care plan, which has no bearing on the reality of the quality of their health care? This is, again, it weighs more heavily what people think of their healthcare. So, for example, someone who has a sack lunch that's free from the government and consists of Wonder Bread and bologna, right? They might be more satisfied with that sack lunch than somebody who's paid for their own, where they have organic produce, meat, and lean meats and fruits and vegetables. They go, well, you know what? I paid top dollar for this, and the steak's kind of stringy. Where someone's going, I love my bologna and Wonder Bread. It doesn't mean that it's a healthier lunch. The second study they point to is a Commonwealth study that it's a little bit more recent. They studied 11 of the top nations as far as healthcare, and out of 11, they ranked the United States number 11.
Jerks.
Number 1 was the UK. Okay, this is important for people to understand.
With the
and if you're not confused yet, the UK was 18th in the WHO study.
Right,
and they're number 1 in this one.
What? Well, the stats, again, the stats in World Health Report, they don't really have much to do with healthcare. So let's go through this when we're talking about objective data. Life expectancy, also, again, they point to life expectancy, infant mortality rate, right? So again, we've gone through the polling data. We know that Cubans are as happy with their healthcare and Slovenians as the United States. I don't think that's the metric that we should use. So they go to life expectancy. Life expectancy isn't directly tied to quality of healthcare, but also self-care, okay? We have a much higher obesity rates here in the United States and a much more diverse demographic than, say, people who are about all the same height, size in a place like Norway with the population of Rhode Island, okay? Now, something else, World Health Organization, they put a lot of weight on disability-adjusted life years. What does that mean? It means it completely ignores countries that keep disabled people alive longer, like the United States. Infant mortality, that's actually measured differently across different countries, like we've talked about with violent crime rates. We actually count infant deaths in the United States, which would not be registered in other countries because of our higher standards of healthcare. So, in other words, countries that don't count premature baby deaths, we actually do when you compare the two. That's the objective data they use. There's a reason they go to life expectancy and to infant mortality, and then go to these two studies primarily. Watch it when you watch Pro Medicare for All videos out there in segments, and tell me that's not what they do. If we do some standardized comparisons, objective numbers, this is one thing that's funny from the left. They go, if you look at facts, okay, well, let's look at facts.
Let's do it.
Compare numbers, United States, UK, Canada, since UK was rated #1. Do they actually offer better quality care? It's not even close, okay? We have over 9 times the MRI machines of Canada, for example.
We like to collect them.
That's the empirical. I can give you the anecdotal. My mom was going to have to wait 1.5 years for an MRI because she ruptured a disc. But that's what they call in Canada elective, along with serious dermatology, neurology. That's another thing we'll get to in a second.
I waited 15 minutes, by the way, for my MRI.
Yes, I know.
I literally walked in, got it, and
because of
left.
evil private insurance companies. By the way, your likelihood of dying from prostate cancer, breast cancer, myriad terminal illnesses doubled. That rate is doubled if you live in the UK, New Zealand, Germany, and Canada compared to the United States. And this is something too. They say, why if you don't support socialized healthcare, why don't you care about the 40-something thousand people who die without access to care? Well, why don't you care about the 100% increase in women who will die of breast cancer? Well, I can play that game too. I assume that you care. Assume that I care. We don't want people dying. We don't want people sick. We just have different solutions to these problems. If you look at death rates specifically among hospital patients, let's go to the old #1 ranked UK, 4 times as likely to die in a #1 ranked UK hospital in the United States. If you have a terminal illness in a UK hospital, it goes up to like 6 or 7 times that compared to the United States.
Stay home.
Something else, yes, we spend a lot more on healthcare, but we are the #1 worldwide country in the creation of new drugs and publication of medical research papers. Again, it's not even close if we're including that in the data, if we're including the quality and new drugs and how much we benefit the rest of the world, just like paying a disproportionate amount into NATO. You're welcome. I don't know that they're ignoring the numbers or if it's just given to them by aides, because it is interesting to me if you go, well, hold on a second, Bernie, hold on a second, Elizabeth Warren, hold on a second, every single leftist host out there, you right away go to life expectancy and infant mortality. What if you go to survival rates of terminal illnesses and cancers? What if you go to your likelihood of dying in a hospital? What if you go to wait times? Do they not know that? I'm going to assume that their motives are altruistic, and just like Barack Obama and all of these people with the pay gap, they don't have access to Google and or Bing at a local public library. Their next claim
Yahoo would have done it, okay? Something.
Web crawler. Another claim they make, Medicare is actually more efficient than private insurance, and they specifically talk about when you look at the percentage of revenue spent on privatized healthcare and administrative costs versus what we would have with Medicare for All.
Private insurance companies in this country spend between 12 and 18% on administration costs. The cost of administering the Medicare program, a very popular program that works well for our seniors, is 2%.
It's very popular.
We can save approximately $500 billion a year just in administration costs.
Okay, who gives a rat's ass? Listen, if we're just talking about numbers and we're talking about what's more effective and what's a higher quality of care, a very popular platform, what does that matter?
Popular.
This is one thing, too, by the way, they can use the exact same argument I've heard from the left. They go, people talk about how they don't want socialized healthcare. Do you know what the most popular healthcare system is in the United States? When people are polled? The VA. Okay, I can use that exact same argument and just say it another way. To give you an idea as to how irrelevant popularity is in the face of quality, do you know what the #1 rated most popular system in healthcare insurance would be in the United States? The VA.
The one that's complained about.
We all know that it's broken. By the way, hit the notification bell. Bookmark this page on YouTube because apparently notifications don't go out to everybody. Of course, join up louderwithcrowder. I said of course. Of course, join up louderwithcrowder.com/mugclub and on iTunes. So listen, it's true. Okay, private insurance. Insane regulations, government red tape, a lot of administrative expenses. It would be disingenuous for anyone to go out there and say that that is not the case. That being said, it is an inaccurate comparison when you're saying, okay, this is the cost of private insurance and these are the overhead costs. And you compare it to current Medicare because you're talking about a plan that would expand Medicare to everybody.
Yeah.
Let's ignore the fact that Medicare is basically insolvent and there are actually fewer doctors than ever accepting Medicare. 1 in 5, okay, refusing any new Medicare patients at all. Let's just assume that that's all hunky-dory, okay? If you compare the administrative expenses, Medicare, okay, it's not the same because patients over 65, they spend far more overall on healthcare. The administrative cost is a much smaller percentage spent on healthcare. When you expand that to everybody, you're going to have some very different numbers. This is why actually left-leaning PolitiFact, they rated this argument half true.
Yeah, I'm surprised about that.
And so this is because people don't understand that administrative spending, it's different, for example, than bureaucracy in the government. So administrative spending, for example, in private healthcare plans and insurance, they actually sometimes are spent a lot of these costs to reduce costs overall. Sometimes when you look at cost efficiencies, that requires administrative processes, and that's why you actually have a more efficient program with privatized healthcare. Doesn't mean that it's the best. Right. Doesn't mean that it's flawless. That's not what I'm saying. But again, we need to compare the numbers. There needs to be more of an apples to apples comparison, not apples to crazy socialist propaganda. This also brings us to something else where they constantly say, I don't understand why the United States, the richest country in the world, is the only country that doesn't have some kind of a universal or socialized healthcare system. Well, hold on a second. You can't bemoan the fact that we're the wealthiest country in the world and we're the only country that doesn't have this kind of... That's how we got that way. It's like saying, we're the only country in the world that, according to Berkeley, 70% of drugs and published medical research papers come from this country, and we can't get a socialized system like everybody else who's the remaining 30%. That's all countries. Well, yeah, Gene, why do you think that's the case? How do you think we got so wealthy? How do you think we got to this kind of innovation? All right, another claim that they make, the United States has more uninsured people than any other countries. Well, okay. Yeah. Sure, but the uninsured number is misleading.
It's very misleading.
It includes illegal immigrants, by the way, who pay nothing. You know why they pay nothing? Because they can go into an ER, there's no way to track them, that's what they use for their care. It's not necessarily preventative care. But if you have a 2x4 nailed to the back of your skull from working a construction site, you know what? You'll take that for free all day long and twice on Sunday. And by the way, there are a lot of people who choose not to purchase insurance. In fact, actually, studies have shown that sometimes there's an increase in total number of uninsured people as a result of people with above average income just opting to go uninsured. That's why they had to instate a penalty while the actual number of uninsured poor people goes up. So that's important to note. By the way, everyone here at Louder Crowder, uninsured. We use a health sharing service, which numbers in the 7 figures, which would not be qualified as insurance. It's a health sharing program, which actually covers you much better than most insurance. So these statistics aren't everything that people believe them to be. The left, they'll say, again, these people, this is very important. They'll say it's less expensive and higher quality of care. Say, okay, tell me how it's higher quality of care in, let's say, the United Kingdom or in Canada. Don't use infant mortality or life expectancy. Go. There's nothing else.
Exactly.
There's nothing else.
You're screwed.
There absolutely is nothing else. So that's important to note because they'll say we're right on facts, and they really cherry pick probably the most irrelevant facts, certainly the least comparable facts. Okay, what else do we have here? Oh, another claim. That's right. I forgot. Medical bankruptcies. You hear this a lot. Oh yeah. They talk about how 2/3 of bankruptcies in the United States are caused by this is parroted a lot right now by medical bills.
2/3 of all the bankruptcies today in the United States are due to medical issues, medical costs.
No. No.
That's just a flat no.
That's just a no.
Hard
That's
pass.
Untrue. This is important. People say, I understand, because you can tweak data to make it sort of match your narrative, and that's why I say you have to determine your worldview first. Do you want to focus primarily on quality of care and innovation and the best healthcare, or do you want to focus on giving everybody access to a crap sandwich? Studies have shown repeatedly the entire concept of medical bankruptcy, it's based on a statistical fallacy. Okay? This assumed that bankruptcy was caused by medical bills if the individual just so happened to have experienced medical debt at some point prior. And how often do you love to hear the sort of the leftist pseudo-intellectuals now say, correlation doesn't equal causation, because it's the first thing they learned in Humanities 101 and philosophy. Well, guess what? In this case, it's actually true, mister. You're going on next to the flying spaghetti monster. I see where you're going with this. When they looked for correlation, the overwhelming majority of people who experienced significant medical debt, they did not declare bankruptcy. So you're just saying, well, if someone goes bankrupt and they're more likely to have had a medical debt incurred. Well, absolutely. But then if you look at the vast majority of people who did have some kind of medical debt, they didn't go bankrupt. This is the perfect example of correlation is not equal causation. It's like, if you look at 60% of serial killers, they all ate Apple Jacks. In the last 2 weeks.
No. It was caused by Apple Jacks.
So, Kellogg's, Ted Bundy. We think that just like Ruger should be liable for the mass shooting, we think that Applejack should be liable for Ted Bundy and or Gacy. More money, please. If you go and watch Bernie Sanders interviews, you can see him at one point. They say, well, what about people, for example, who might not live the healthiest lifestyles? Do we have any kind of exceptions when we're talking about Medicare for all? And he goes, oh, no, because then at that point you might have someone who's slightly chubby. We're not going to play that game. Because what about people, and this is an actual interview with CBS. I don't have it here ready. He goes, well, what about people who smoke? We're going to try and get them off of that habit. And he starts, hold on a second. What if they don't want to?
Right.
You can't say no under Medicare for all, and of course costs will skyrocket. So even if the numbers that we have now, hopefully we've illuminated them for you, they'll only get worse if you throw everybody onto a Medicare-like plan.
Yeah.
And so even right now, if you only look at costs, it's still a wash. And here is something that I think is important. People talk about doctors, okay?
Yeah.
First, do no harm. A doctor is not supposed to go in and put you on the most aggressive treatment possible. A doctor is supposed to go in and do no harm first and see what the minimum effective dose is for whatever treatment they're giving you. That's what we need to start with our current healthcare system. People, they're against this idea of incrementalism. Well, what if incremental solutions would actually create a world of difference? For example, opening up insurance across state lines, tort reform, allowing insurance companies to create incentives for people to be healthy and rewarding that, just like we do with car insurance, right? Yeah. As opposed to punishing people who don't get insurance, as opposed to punishing insurance companies that say you live on a diet of ring-dings, Funyuns, and fried Oreos. We say you have to accept everybody, and by the way, we're not going to put caps on premiums. This has been a giant kickback to the insurance industry. But I do want to say something here. What bothers me most about this, and if you want to look at people who are being intellectually dishonest, the people who say, these people don't even believe what they say on the right, and they don't care if you die, and they don't have any facts, they don't even believe their own horse crap. You hear people on the left saying this. Let me tell you something. I think our healthcare system is broken. Okay? I think it's something that needs some solutions thrown at it, at least. But I don't think that it's unreasonable for the left to look at our current system and say, you know what about Medicare for all? I think it's wrong. I don't think it's unreasonable for people to look for radical solutions in the face of a system that we all experience and we all realize is broken. So I'm not going to assume that all of these people are lying to you, that all of these people are making data up, or that they're selectively omitting facts that illuminate the picture most clearly. What I will say is I understand why people are looking for solutions, and I don't think that it is ill-founded to look to examples like you see with other countries. The devil is in the details. Yeah. And what really bothers me is when these people say, well, why don't you care about dead people? Why don't you care about the people who are uninsured? That is one of those kinds of arguments that stops the conversation before it begins, just like calling somebody a racist, sexist, homophobe, transphobe. You see this coming exclusively from the left. You don't see the right saying, hey, these people want to kill all of you. They don't care about the 100% increase of women dying of prostate cancer and breast cancer. We say, you know what? Listen, we believe in the highest quality of care. We believe that we have the best healthcare system in the world and we need to fix it. And we see that you have a different solution and we think that it is incorrect. Why don't you care about the people who will be killed? Why don't you care about the people who will be sick? Why don't you care about the millions upon millions of people who will likely die if we don't continue with a kind of system that provides some sort of profit incentive to create and develop new drugs? Why don't you? We can all play that game. Yeah. Let's assume that we all care about everybody, that we want everyone to get the best healthcare possible, and we just have different ways to do it. And I will argue, of course, that the facts are on my side, but I'm not a doctor. Hey there, if you like this video, subscribe or click one of these videos playing in a box. You know what? Hit the notification bell, because subscriptions don't really mean anything anymore, especially if you're not 18 or older, at the very least logged into YouTube as 18 or older, because sometimes people are 25, but they don't know how to use the YouTube system properly, and then you never, just hit the notification bell, or you hate yourself.